If you think behavioral health is hard, try behavioral health and long-term care. Well, that's exactly what today's guest has done. Welcome to HealthBiz Briefs. I'm David Williams, president of Health Business Group, here with Rocco Coniglio, a serial business builder in healthcare who's currently at Red Rock Capital and Advisory. Welcome, Rocco.
Thanks, David. I appreciate you having me.
My first question is, why would you build a mental health business for long-term care in the first place?
Good question. I'm going to give credit to my wife, Nicole, who I co-founded the business with. She really identified an opportunity in that particular space where, she saw a lot of mental health care needs in the long-term care space, and not a ton of providers that were able to or willing to provide that care in that particular setting. And in addition to that, there's a regulatory environment in the long-term care setting, and more specifically in the skilled nursing facility setting, where there's a really strong value proposition for anyone that can provide psychiatric med management, because it's just they're highly regulated medications, and to be frank, those medications are they can be overprescribed in many cases, so that can contribute to polypharmacy, which has an effect on many other specialties. So you're really helping you're helping the patients, you're helping the families of the patients, and you're helping other specialties as well, because that polypharmacy can negatively impact many other specialties, from primary care to wound care, and so on.
Telehealth has come up, especially during the pandemic, in a lot of specialties. I wouldn't think it's the most obvious for what you're doing, but on the other hand, it was difficult to be able even to access these facilities during the pandemic. So I'm wondering what sort of a role telehealth has played in this business.
Yeah, so telehealth was not part of the business when we started it. However, it became a large part of the business during the pandemic. I think that I think we're behind the curve on telehealth, as generally speaking, for healthcare. And I think the pandemic forced some of that upon us, which I guess could be part of a silver lining to it. So but I don't think that necessarily replaces in-person visits and some of the value that you can get from some of those in-person visits, even in mental health. I think mental health is an obvious place where you can use telehealth a little bit more than you might be able to in other specialties, where many other specialties need to be more hands-on. But we always viewed telehealth as a tool in the tool belt, not like a binary, are you telehealth or are you in person?
I know that your business has leveraged advanced practice nurses, and I'm wondering how that's worked out for mental health in long-term care, and what the broader implications are for leveraging that workforce.
I think that everyone's looking to leverage that workforce in some way, shape, or form. And if you're not, you're probably, you're probably behind the curve on that as well. I think that primary care and mental health both look to leverage that particular space. I think that given the economics in primary care, you're probably going to see more APRNs in that particular area. You're probably going to see more physicians graduating in specialties than in primary care. I'm not saying that that's right. I'm just saying that that's kind of the condition of the market right now. Frankly, I think primary care physicians have a very difficult job, and I think they probably have one of the most important jobs and are undercompensated. But I think that given where reimbursements are, it's just a function of what we have to deal with. As far as mental health goes with APRNs, there's even a larger layer to that, which is you just have a supply issue, and so you're not going to based upon the data that's out there, you're not going to solve the supply issue with the psychiatrists that are graduating from fellowship right now.
Right.
And because the supply issue is low, and then the demand increased over COVID and has continued to be high after COVID, you have to augment what you have in psychiatrists with other practitioners, and I think that psychiatric mental health nurse practitioners are are a very good solution to that. But I also think that you have to manage any provider network that you create with a lot of quality guardrails, whether it's physicians or NPs. So I think that's also an important component to it as well.
That's it for the latest HealthBiz Brief. If you like what you hear, check out my HealthBiz podcast for a full-length interview with Rocco about his life and career. Rocco Coniglio, thank you for joining me today on HealthBiz Briefs.
Thanks for having me, David.